medicine is one area which needs lot of change. After all, change, you know, if you go to the dictionary and see what life is, ceaseless change till death. You keep on changing every day, and with that, society also changes, and we need change a lot. I always say, don't go to the doctor for asking for health, don't go to the police asking for honor, and don't go to the judge for justice. If you are ill, go to the doctor. If you have somebody has harmed you, then go to the police. And if some injustice is done to you, go to the court. Similarly, when I became a doctor more than half a century ago, it's little over 60 years now, I found there are a lot of change needed in medicine. Because what we used to do is, we used to get our patients, to get more patients, we used to frighten them. And the whole thing, medicine depended on fear of disease in the first place, and that's why you go for a checkup. Fear of dying is the biggest fear, and you go to every doctor the minute you think you will die. The fear of not knowing what is in store for you. So we cash in on this fear and make money, although our ethics says do not make money in the sick room. That's where we make all our money. So medicine was in a bad shape in the 19th century. Actually, to be precise, in 1823, they took a statistic in London. Very few doctors were there. They found that these doctors were incompetent, corrupt, and very, very dangerous. And one of them thought, a young doctor, thought that these were an abscess on the human body and they were killing the human body. So he said, I'm going to start a science journal to teach them science so that they change and the world will become better. So he started a journal called Lancet, The Lancet. Lancet means a knife. So that was the name of the very famous journal, started in 1823. And his name was James Wakeley. So Wakeley died and the journal continued on and off with little difficulty for 185 years now. So the present editor, Dr. Horton, wanted to find out what has happened to doctors after Lancet started and science came in, so-called science. So the audit now shows that what was once an abscess on the human body with a corrupt bunch of doctors has transformed itself into a corporate monstrosity all over the world, which is killing. Today you go into a corporate hospital, even if you sneeze, they'll do every test under the sun and then give you a huge bill. And more so, if you are insured, you're finished. Medical insurance is the biggest danger thing, because they find out, are you insured? Yes, then we'll do all the tests. Are you rich? We'll do all the tests. And the best part of the whole story is that the poor man doesn't suffer the medical industry. And that's the only saving grace in our country. So what I did was, I tried to sort of change the science of medicine and did a lot of work and published about 250 science journals, articles in various journals all over the world. Nothing happened. Saying that, sorry for writing what I did, and the mind is not in the brain, because brain is a small organ which can't hold the mind. So mind is everywhere, mind is universal, mind is a canvas on which your thoughts are projected, and mind is consciousness. And when consciousness came into science, mind had a new connotation. But even today, what do we do? For mental illnesses, we still give chemical drugs. What do? They go to the brain and damage the brain. So there's a professor of neurosurgery and neuropsychiatry. This girl, Grace Elizabeth Jackson in New York University, she wrote a book, Dementia, a drug-induced crime on mankind by doctors. We say, oh, he has got dementia, he has got Alzheimer's disease. This is all created by us, by the chemicals that we give. Every chemical that we give is dangerous. So I said, why not take the help of other systems of medicine also, even there is something good about it. So I looked at the reason why modern so-called Western medicine has become dominant, because it's the money power of the drug lobby that has made it, and the government helped it. The American government helped it. Actually, there was a demand in the American Constitution itself to demand that this monopoly of medical treatment should not be there, but that was deleted because the drug lobby worked, because drug lobby was held by the richest people in America. And even today, the drug lobby is the one that runs science. And you all say Western medicine is evidence-based, Indian medicine is not evidence-based. What is evidence? It is the evidence that is created. You can create evidence. For example, for 50 years I have been saying cholesterol is not a disease. Coconut oil is the best oil because coconut oil and mother's milk contain the same fatty acid. So coconut oil can't be bad and other oils are not good. But nobody believed. They laughed at me. Now United States of America has found out that's true, and now everybody says coconut oil is good. Coconut oil prices have gone up skyrocketing because America has said that. So we want everything come from America because we are 200, nearly 300 years of Western rule. We have become mental slaves. We have become politically independent for the politicians, but not for you and me. You and me are still resident non-Indians, RNI I call you. You are staying here, but thinking with the American mind or the English mind. This RNI mentality has to change. If you go deep and find out what happened was, in the 50s, it was found that sugar is very bad for the heart. Sugar is a poison, which is true. But the sugar lobby got worried. So they hired 3 scientists, so-called quote-unquote scientists. Who is a scientist? I'll tell you later. If I forget, remind me. 3 scientists to create a myth saying that fat is bad, not the sugar. So they created a beautiful thing called cholesterol, fat, and even today, a lot of people call me and say, my fat profile is bad, doctor. I said, what is the fat profile? Don't worry, if it is bad, it's good for you. You will live long. But they worry about it. Then we have a drug for everything. So we always believe that, or the patient believes that the pill for every ill. And I changed that to say that while there is no pill for every ill, there is an ill following every pill. Even aspirin has got so much of side effects. The people used to swallow an aspirin tablet after the age of 40 to keep the heart attack away. The audit shows while aspirin may or may not reduce the heart attack rate, it will 10% of aspirin takers certainly get fatal cerebral hemorrhage, brain hemorrhage. I have lost a very important educationist, a patient of mine, who was vice chancellor of so many universities in Karnataka, very important man, very nice man. He was given aspirin. So I told him and his family, please stop that aspirin. But they wouldn't listen because they said, no, our doctors have given it, we should take it. He continued, and one day he was phoning up a friend of his in the evening and then just collapsed and became unconscious. And when scan showed, he had bled into his brain completely and the brain was completely suppressed by the brain and he died on the spot. So this is what is happening. So even aspirin, so don't take medicines unnecessarily. Take medicines very carefully. Then I said, what are the common things? An audit in Canada showed that when a doctor sees one patient, a heart attack patient in society, he will have seen 36,000 common illness syndromes, which are called minor illness syndromes. We don't even teach that in the medical school. We teach about the coronary artery branches or the facial artery branches, but not about minor illness syndromes. What are the minor illness syndromes? Common cold, feverish cold, flu-like illness, sore throat. And for all these things, today we go to a hospital doctor and get so many medicines or television advertisements. सिर में दर्द है, हाँ यार, ये भी है, हाँ हाँ यार, और भी ये है, हाँ हाँ यार, तो 5 दवा लेना, एक नहीं. Take these 5, and it swallows that, and immediately the whole thing becomes normal. So you believe that. Actually, these are all. It was Harvard University, one Professor Simon, who showed that our old granny's ginger is the best antiviral drug, ginger. Ginger, pepper and garlic together will probably solve most of these problems without any side effects at all. Last but not the least is, the commonest thing that you get is a sore throat. And you go to a doctor and take an antibiotic. An antibiotic spoils your health. But you would be surprised to know that the best treatment for a sore throat is hot water sip. You sit quietly, take a mug of hot water. If you want, put a little lime in it to make it tasty, and keep on sipping for about an hour. When your throat becomes 1 degree centigrade higher, the viruses die and you are okay by afternoon. So simple. And all this is because we have wonderful treatments in other systems also, which we say do not have evidence base. Now we know the evidence base of Western medicine is evidence manufactured. I told you how fat became an evidence for heart disease. Similarly, all other medicines are like that. So all these things you have to spread now. So all this, I do an average every week at television view, and I do 1 or 2 YouTube videos. So all these go around, and now I have got statistics say I have got about 5 million people in the world who are influenced. I get calls from Australia, America, China, everywhere, and I get consultations on the YouTube, on email from all these places. Because I'm free, I'm doing this free, I just can't cope up with it because I get about 200, 250 email consultation requests every day. And people have a myth that saying that I don't have to see the doctor, my reports can be seen by the doctor. So I always tell them, I have got a set written. I have not learned how to treat reports. I have learned how to treat a human being. And I don't believe in disease, but I believe in the patient. Hippocrates said, know thy patient more than his disease. And when once I know the patient, it's very easy to treat, because supposing I have a headache, I don't have to go for a tablet. I know if I know the person very well, and if I know that he and his wife are not getting on very well, I just have to pat him and say, why did you fight with your wife yesterday? The headache just take it easy. And I had a patient, a very important man in India. If I told his name, you'll all know, stand up. Keeps seeing me every time I go to Chennai with, I have a small headache here. Yesterday again he came. He is 94. And he said, I have a small headache here. So I told him, dear sir, because you have a head, there must be an ache. And I have a treatment for that. He said, he is a colleague of our CNR Rao and all. So when CNR Rao got the Nobel Prize, what is it called? Bharat Ratna Award. This man did not get it. After that, the headache started. So I said, I would, if I have the power, request the government of India to give you a Bharat Ratna or whatever, Bharat Ratna or so, your headache will go. He laughed. And his assistant told me afterwards, sir, Ninge Satyama Sonninge, this is exactly our view also, but we can't tell it because he's a big man. That's the right treatment. So yesterday again he came, so I told him, don't you worry, nothing will happen, your head is all right. And he has had all things, CAT scan, dog scan, PET scan, and each time he goes to the doctor and says, I have a headache, they scan his head. And I said, at this rate, you will have a cancer in the head because you have been scanning so many things. So this is the story. So if I know the person, I know the treatment which doesn't require medicines. My suggestion is you require as less medicine as possible. Life is very good. I had a stroke recently. I followed all the rules of the game to lead a healthy life. I was lecturing like this in a college for about 2.5 hours. I was standing lecturing. After that, I went for a meal. Then I found my leg was a little weak. Started there. But anyway, I recovered. Thank God. Let's cut the long story short. I've written an article about it. It's called Autopathographies. I've written how it happens and why it goes. All this is because it's in the mind. Ultimately, the mind is the seat of all the disease. And mind has to be corrected. So, I was telling that scientist yesterday who saw me for a headache, I said, sir, we have all the gadgets, but we don't have a mindoscope. If you can get into your mind and decipher your mind, your headache will have gone. He said, yes, mindoscope, that's a very good idea. Then I said, no, see, that's how it happens. But mind you, this is very difficult to change. Change is very difficult. But these days we are better off. When in the 18th century, Simmel said, doctors don't wash their hands and that's why patients die. That other doctors thought he was mad and he was put into the mental hospital and he died there. But thank God, they have not put me into the mental hospital, though they wanted to. When I first wrote, 40 years ago, I wrote a book called What Doctors Don't Get to Study in Medical School. Such a bad review was there in Indian journals. They said this man is mad, he doesn't know medicine, he has to be put in jail, etc., etc. But then after a week, the British Medical Journal wrote a review on the same book, which said this is not a textbook of medicine, but this is holy text of medicine written by a prophet. Then Indians changed. Then they said, okay, that book must be good. So the book is in several editions now. But that didn't change much. The day I changed myself, I was a young man and had a lot of degrees and things like that. And I had lost my head. And I didn't know who I was. But one day, a young lady lost her husband at 2 o'clock in the morning. Absolutely fit person who had a massive heart attack and died at about 2 o'clock. My juniors called me and said, sir, please come. This lady is uncontrollable. You come. So I went there at 2 o'clock in the morning and I had not put on my shoes. I had gone in my chappals. Walked into the ICU. This lady was rolling on bed and she caught hold of my with a big grip of my ankle and asked one profound question. Doctor, why did my husband die? I thought for a while, my God, with all my lore, I'm a bloody fool today. I don't know the answer to this question. If she had asked me, how did my husband get a heart attack, I would have given her a big lecture on what the textbooks say. But when she said why, I didn't know. So I went out into so many things, from teleology to philosophy, and found that ultimately a Nobel laureate physiologist said, positive sciences never answer the question why. They answer at best how or how much. I as a doctor can say, how does the heart contract? But I can't say why does the heart contract. For to know why does the heart contract, you got to go to teleology. So that is where I went into Ayurveda, Unani, Siddha, and now I find all these systems are equally good. Then I found a study done in Thailand where there are 5 systems of medicine concurrently working in society. Western medicine, pure Chinese medicine, integrated Western Chinese medicine, Samoa system where the father tells the son what to do. And the study after 5 years showed that all these people are equally effective as long as they had interest in the patient. I always tell my students after that, whether you like homeopathy, homeopathy, Ayurveda or whatever it is, as long as you have empathy and sympathy, you are a good doctor. Now my slogan to my medical students is, be a good human being, you are a good doctor. You don't have to have any big degree, etc. Because patient must have faith in you. When once he has faith in you, that's called the placebo effect, you will get cured. So many people said, oh, what is this man talking about? When I get bypass surgery done, it's bypass surgery done on me. So where is the placebo effect? My former chief in Harvard did a very good study. 600 people over the 5 years were sent for bypass surgery to Harvard Medical School. And he examined them and found none of them needed bypass surgery scientifically. But then they have come, they have paid the money. Anyway, the hospital has received the money. So he had 2 theaters, theater A and theater B. And he sent the patients blindly into 1 to A, said 2 to B. A was anesthetize, operate, send. Because those days we were doing with the laser beam, so you don't have to cut the chest. And B was anesthetize, keep him sleeping. When he wakes up, tell him he had a wonderful operation. And now after 10 years, they found that those who went to theater B had nothing. They were all normal. Their blood supply had come back to normal. Their scanning had become normal. But those who went to A, half of them did not get relief, so they had a cut open surgery. The other remaining half of them were in heaven with their maker. The remaining half are suffering from the drugs that they're receiving. So the conclusion was, even bypass surgery is a placebo effect. And in India, it is definitely a placebo effect, because after having paid 10 lakhs, if you don't get a placebo effect, you are not a human being. So friends, change is a must, because knowledge, said Karl Popper, who was a physicist, became the professor of science philosophy in the London School of Economics in the 50s. And Colossus in that, he said, I quote, Karl Popper said, knowledge advances not by repeating known things, but by refuting false dogmas. Look at what the police commissioner did. The knowledge was that the crime statistics helps. Actually, that's what is being repeated even now in the papers, crime statistics. But he found out that it's a myth. Crime statistics doesn't really give the image of the police. So he changed that. So knowledge advances by changing myths and not by repeating own things. So a lot of myths in medicine, my dear friends, hell of a lot. And we have to change that. I'm trying to do that. Now I got a lot of followers. Medical students come to me and say, sir, can I get an internship with you for 2 months? I want to learn something, sir. And they bring their parents to me for consultation. And this is how the world changes. Medicine also changes, needs change. And everything else in life changes, because life changes itself. Change is life. And there was a big case in the New York court between creationists and scientists. And the court, the judge in his wisdom gave a judgment saying that science has changed. Medicine has, creationist ideas have not changed. So you can't be scientific. You are just religion. And religion is not science. So friends, science has to change. And change is science.
Knowledge advances, wrote Karl Popper way back in 1950s. Not by repeating known things, but by refuting false dogmas. This is how knowledge advances. For example, it was said by Ptolemy in the 2nd century that the sun goes round the earth, which was followed for 500 years, up until Copernicus came and said, no, the other way around. So this has been going on like this. In medicine and in the area of health, This myth is perpetuating for nearly 2000 years now, from the time of the reductionist science of Descartes. What is health? There's a definition called Alma Ata definition of health. Health is absence of this disease, that disease, all kinds of diseases. If you analyze this, it's just a business definition, because if you want to know whether you're healthy or not, you must go for a checkup. And that's a big business, because you're checking up the whole population of the world, if you really can. Because if you're treating only the ill people, it's only a few million in a given day. So that's not the definition, but Indian system of Ayurveda for thousands of years had a beautiful definition, which simply means, in a sense, if you have enthusiasm to work, mark my words, and enthusiasm to be compassionate, you are healthy. You can have a disease, because all of us have disease. If I now scan all of us for a cancer cell, each one of us will have more than 5 to 10 cancers already inside. But they don't become clinical cancers and kill you, they die themselves. And this is a very important thing. So on a given day, nobody is totally healthy, which if it means that without disease. So this definition of health is very convenient, because you can know yourself in the morning. Get up and ask, do I want to go to work today, or do I have to go to work? If you say, and I want to go to work, you're healthy. Do I have to be compassionate? If you say, yes, I have to be compassionate, that's compulsion. I want to be compassionate. And if you want to be compassionate, you're healthy again. Now, having said this, I must tell you the myths in the area of health. When you go and see a doctor, the first thing he asks is, did your father have cancer? Did your father have stroke? He had a heart attack? You get frightened. And if any one of these is positive, you start dying that day. I may get a cancer. I may get heart attack. I may get this. I may get a stroke. All this is myth. You and your parents have nothing in common, because you are not come from your parents. Actually, this is the Indian thought. Children do not belong to parents, they come through parents. But our ancestors are not our parents, but the germs. This world for the first 2000 billion years was run by only germs. And every other planet is like that. And these are the germs which are very compassionate, and they donated a DNA each to us to make the first nucleated cell called the zygote that you and I were on the first day we were made in the mother's womb. And that one cell has become a colony in you of 120 trillion cells, in association with 1200 trillion germ cells. So for every single cell of yours, that's human cell, you have 10 germ cells. So we are germs. And this germ theory propagated by the Western medicine to use antibiotics as medicines is the one that is killing mankind all over the world because of superbugs. Now germs are our friends, and germs have brought us here, and we belong to them. So you don't have to worry about your family history of this disease or that disease, because there's a big myth going on saying that your genetic analysis, your genome studies, your genetic engineering, stem cell study, preserving your cord blood of your child, preserving your dead body, etc., etc., is a multi-billion-dollar industry. All that is a myth. What is true today is, if you are healthy today, you're lucky. If you're unhealthy today, you're lucky. There's nothing that you can do to preserve your health or continue it. But one thing is, health is environmental. Health is not genetic. You're not inherited from your parents. Health is purely environmental. In this context, we again talk of, and we have been talking about, the risk factors. Your heart disease, your hypertension, diabetes, body weight, height, weight, mass index, your girth of the abdomen, girth of your all kinds of things we talk about. All this has been again proved wrong, because a largest study, the longest study and the biggest study, which is called the MR-FIT study, Mr. Fit study, multiple risk factor intervention trial, which went on for prospectively 25 years, showed that there isn't anything called risk factor. Even if you remove the risks by intervention, the risk, if anything, remains. So even if you either remove the risk factor or not, the risk remains. But the only thing that can save you is change your lifestyle. This is because lifestyle is the biggest environment. What is the environment of the human body? Human body is in fact human mind only. With quantum physics, we have quantum understanding. Matter is energy, energy is matter. For such of you who don't belong to the science stream, I'll give you a nice article. Please read this. Matter is not made out of matter. That's the article. Matter is not made out of matter. written by a man who got the Nobel Prize and the alternate Nobel Prize, because he called E is equal to M, energy is matter, matter is energy, as a duality. And the man has written this article so for you, and in the article he writes, I quote, he says, I am just a scientist, like a child playing in the sands, the sand time. But the Indian sages have called this Advaita thousands of years ago. And he says, that is the philosophy that runs quantum physics. And your body is a holographic projection of your mind, which is called your consciousness. And the mind is not in the brain as we think and as we practice in psychiatry. We give you drugs when you have some mental problems. These drugs go and affect the brain where the mind is not there, and the brain gets damaged. So the drugs only damage the brain and do not treat you. As a matter of fact, create more problems. But what is important is the mind is the environment of the body. I am repeating this. The mind is the environment of the body. So if you have to get any disease to the mind and to the body, it's again the mind that affects the whole thing. And if you want to get rid of it, you have to change your mind. So in short, mind your mind, and that will mind your illness and wellness. Now, what is the most important part of the mind? Your thinking. The most dangerous part of the environment of mind is arrogance, hubris. I. You know, I. You all know I. I starts illness. You just change that I into we, wellness. That's all the difference. Did you understand? The difference between illness and wellness is how you look at yourself. If you think you are the biggest man under the sun, you are always ill. Remember that. Almost all our politicians have got all kinds of illnesses. You don't know them. They take so many drugs. Now you think there is a drug for everything, so why worry? One patient came to me once and said, look doctor, I want to drink, I want to smoke, but I don't want to get diseases. Give me a pill. This is how people think, because they think there is a pill for every ill. But the reality is, while there is no pill for every ill, there is an ill following every pill. And this is true because every pill is a reductionist chemical. And studies have shown when you take a pill, irrespective of what pill it is, from aspirin to the statins or whatever, it goes inside the system and the body's wisdom says, oh, this doesn't belong to me, I don't know, this is a poison, so it must be destroyed, it sends to the liver. So every tablet that you take, every injection that you take, the drug chemical goes to the liver and damages the liver. And today there is an epidemic called non-alcoholic cirrhosis of the liver. It is a very dangerous disease. There is no treatment at all. The only treatment now they claim is liver transplant. And all this is because today we have a huge disease called adverse drug reactions, ADR. And the ADR is a leading cause of death in the world. And this is because we think wrongly that the disease can be corrected by correcting the body. The disease cannot be corrected by correcting the body. Disease can only be corrected by correcting the mind. And this was shown in elegant studies. And it's also shown that the disease is cured by your own system. Remember that? It's not the outside system. Your own system cures the disease. And this is very interesting. They did a large study in Oxford University with the collaboration of Oxford, Cambridge, Munich and Hamburg universities, led by Oxford's Professor Bengal. And this study, they showed that a patient has severe pain, the worst pain that you can have, because pain is man's greatest enemy. Yesterday pain was the enemy, today pain is the enemy, and in your tomorrow also pain will be the enemy of mankind. And our job is cure rarely, comfort mostly, but console always. Even a patient with cancer, I can console him. Even a patient with any kind of pain today, I can relieve. But I was thinking, up until this study came out, that we are treating pain. On the contrary, what's happening is this study elegantly showed that patient had severe pain and they were giving him intravenous drip of morphine. Morphine is the best painkiller. But they told the patient, this is not morphine. What we are giving you is a new vitamin we have found out for you. It will not remove your pain, but your disease will go. And would you believe nobody's pain went? Pain did not disappear. Morphia was going intravenously. If you take a tablet of morphia, your pain will go. Then they were surprised. So they did a crossover study. They ran a saline drip, simple saline drip, and told the patient, this is the best salt of morphine that we have discovered. And your pain will go like that. And would you believe the pain went like that? They were nonplussed, what's happening? So they repeated the whole study with an fMRI, concurrent fMRI. fMRI tells you what the brain is doing. And when they found that morphine was running, but the patient believed, mark my words, believed, because he had faith in the doctor that it's not morphine. When he believed it's not morphine, the brain slept. When saline was going and the doctor told him it's morphine, and he believed the doctor, and then pain got relieved because the forebrain produced such powerful opioids that in no time the pain went. So who treated the pain? Not the drug, but your own brain, your own body, your own immune system. Similarly, surgery. You think surgery, okay, surgery is something different. No, they did a study, extensive study like this on bypass surgery. And they showed even bypass surgery is a placebo effect. Nothing happens by the surgery, but the placebo effect. The mind says, okay, I am treated. I've had a bypass surgery. Nothing to worry about it. This is a very nice study called Placebo Effect in Bypass Surgery. And the first author's name is Grabos. Grabos is a very big director of interventional cardiology in Harvard. And this study shows that when a patient was taken to the theater, anesthetized, and when he woke up, he was told, you had a wonderful bypass surgery. Your surgery was very successful. And he went home, and he's successful. 1 year later, scanning showed blood supply had come back to the heart, which means you are treating your own self, which is called the placebo effect. If anyone is trying to check this article called Placebo Effect in Science Translational Medicine, very important journal. It's 2011 is the year, volume is 3, page is 70. And the first author's name is Bingel, B-I-N-G-E-L. He is a professor of medicine in Oxford. All this goes to show now that the myth that we are doing everything and every tablet, every disease requires a pill is all a myth. Having said all this, what is the future? What's your tomorrow? Now we have to get a generation of future generation trained to have a healthy mind. Today, what's the training in the medical college or engineering college or IIT? I was asking a girl a little while ago, what are you trying to do? I'm in biomedical engineering and I'm looking at hospital equipment to see whether we can change that and do something better. These equipment do nothing. As a matter of fact, some of these equipments are the bane for our. You simply scan people. You know, in the olden days, there wasn't anything called multiple cysts in the ovary, this, that, and all. Patient is fine. Patient is doing well, but the scan shows something. Is there any woman who does not miss a single ovum coming out of the ovary and making a cyst in it? No, there isn't. But we didn't know that she had a disease. Now, routine screening, everybody had an ultrasound scanning, and they say, cyst in the ovary. The doctor will assure you, don't worry, this cyst is nothing. As you're turning to go, he says, occasionally it may become a cancer. And that's finished. You are dead after that. Every day you're thinking, my sister has become a cancer, my sister has become a cancer. How many of you suffer from gallbladder stones? Most people, they have died at the age of 100 with full gallbladder full of stones. Nothing has happened to them. But today they won't let you. One stone is picked up. And then the man says, do I get this stone out or leave it alone? Then the doctor says, oh, don't worry, nothing will happen. But sometimes, it can come out and block your common bile duct and produce something, and pancreatitis and things like that. And that kills you. So friends, what we have to do is, new generation must be trained. You and I are gone because we are spoiled in this present generation, because up until I went to school, I was supposed to be a genius. I went to school and became an idiot. Because all our intuition is gone, our questioning is gone, curiosity is gone. We are only fed what is to be fed. This is what the Roman Empire started. Socrates started educere. Educe means bring out the best in man. That's called education. Swami Vivekananda said, education is a manifestation of the perfection which is already in man. But the educare system said, teach the child what you want the child to know. And we are continuing that educare. And you put in stuff in things. And this stuffing in things is not education. We have to bring the best out of the child. And that's why you have to use the child as your best friend. And don't use the child as a student in the class to be admonished, to be disciplined, and things like that. No. He's your friend. Leave him alone to do. I have seen a school called the Primrose School in London, where the child comes and says, today I want to swim, teacher. And the child swims. There's a swimming pool, everything is there. The child swims the whole day, doesn't matter. It gets the attendance. Another child says, I want a paint teacher today. So the paint is provided, everything, canvas is provided. Child's pay. And another child says, I want to play chess. It plays chess. Another child says, I want to go cycling. It goes cycling. And that's how a child should be groomed. But ultimately, what you should do is to have a child with a healthy mind, not just a wealthy career. Today, our aim is only wealthy career. This morning, I was seeing the paper. Our students are not now industry, they're not ready for industry from the institutions. They want to train you to fit into an industry. Supposing that industry collapses, what do you do? Education is not just training for a job. Education is making a human being out of you. And that's called education must make a healthy mind. What is a healthy mind? Enthusiasm to work and enthusiasm to be compassionate. Imagine all the 1.3 billion people in India become healthy minded. What will happen? We have so many people to work. Today, even 2% of the people don't want to work. They have to work, that's a different thing. They don't want to work. If 100% of the people in India want to work, and 100 people want to be compassionate, where is terrorism? Where is rape? Where is problems? Where is criminal? Nobody. And even probably the politicians will change. So let us create a generation of healthy minds. And if you have a healthy mind, you have a healthy body. And that's where it is. The usual saying, in a healthy body, there's a healthy mind, is not wrong. It's the other way around. When a healthy mind and a healthy body, they reside together, diseases disappear. And you become very, very tranquil, very nice. I'm coming back to where I started. There are a lot of myths in the field of health and also in the field of diseases. Most diseases are our friends. Don't hate diseases. Love diseases. And tell the disease, let's be friends. And my immune system will cure you. And if you develop your immune system, it will certainly cure you. The whole of Ayurveda is based on this principle. And what does it say? Aptopasevi bhavet arogyam. Treat everyone as your near and dear ones. You will be healthy and the whole world will be healthy and nothing to worry about any part. Thank you very much for giving me an opportunity. It was very nice talking to you.